أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله. إخوة زملاء والأساتذة الأجلاء السلام عليكم ورحمة الله وبركاته. معكم أحمد خالد خريج كلية الطب والعلوم الصحية جامعة كردفان الدفعة 15. أول حاجة نقول إن شاء الله ربنا يرفع البلاء من البلاد إن شاء الله. وكل التحايا للجنة المنظمة للأسبوع للمؤتمر المجهود اللي قايمين به لأنه في الوقت الحالي ده. الزول ما قاعد بتخيل إنه في زول يعني يعمل المجهود ده عشان يقوم بشغل زي الشغل الحاصل في المؤتمر. أم، بالنسبة للطبق اللي عايز أقدمه هو طبق شوية ممكن يكون رير، ما في كمية من الضوء ملقى له، وهو البريست كانسر المين. أم، أم، بالنسبة للبريست كانسر، من هو it's very rare, present in only 1% breast cancer cases. إحصائية في الولايات المتحدة الأمريكية إنه 2650 men develop breast cancer each year. 530 die as a result of that. Um, Unfortunately, no advanced stage of disease is predominantly the presenting symptoms. And no individualized treatment approach for men, but treatment mainly based on clinical trials conducted in women. Um, one of the anatomical disadvantages in we have lack of supporting breast tissue in male, which makes it very easy for the breast cancer in male to spread locally and to invade the thoracic cage and lungs. As in females, triple assessment is mandated. This includes examination to differentiate between physiological/pathological gynecomastia and isolated breast lump with nipple discharge/retraction. Um, Mammography, breast ultrasound, and MRI scan are imaging modalities. It depends on the amount of tissue, of the supporting tissue. If we're talking about male with pendulous breast, might be better to go for mammography instead of ultrasound. If we're talking about man with high chest, maybe an ultrasound scan will be possible. If, as mentioned by Dr. Rabab in the previous lecture, if we are encountering an a unique presentation, MRI is a modality of choice here. If the biopsy is if the ultrasound is inconclusive, so then we proceed to the biopsy. As we can see on the right side of the screen here, we do have breast carcinoma. It's well-defined circular or circumscribed lesion, while the gynecomastia is more like diffuse with well-defined edges. And it's mostly could be physiological or pathological or drug-induced. So there will be an explanation for a bilateral gynecomastia in comparison to a unilateral breast lump which present in carcinoma. When it comes to the causes of male breast cancer, mostly are age. Most cases diagnosed in the late in 60 to 70. Genetic predisposition, having a family history, BRCA2 mutation, and a family history, whether it was a history of a first degree female or male who had the breast cancer. Estrogen, and one may wonder what brings estrogen to men. The answer is the hormone therapy for prostate cancer, for example. Obesity, liver cirrhosis, all will cause an incline in the estrogen level, and this will reflect in more predisposition to the breast cancer. Also, Klinefelter syndrome, which is syndrome of congenitally low level of testosterone. Occupational hazard. Some cases are reported for men who work in a hot environment. This is also one of the causes of the breast cancer. And radiation to the upper chest, or a history of radiation to the upper chest, is associated with male breast cancer. How to manage? And as you recall, we just said that there's no clinical trials conducted in male patients. Most of the clinical trial conducted in female patients, and then the result will probably to male. After performing triple assessment, staging will be next. Unfortunately, 40% of breast cases are diagnosed in an advanced stage. And it was mentioned this is status in the UK, in the United Kingdom, 40% breast cancer in male present with an advanced stage. Now, I like specifically put the UK stat in between brackets because I wanted to say that you can imagine how this reflects in our country. So then options for treatment includes surgery, okay, if it's localized cancer in situ, radiotherapy versus palliative radiotherapy. So in case of advanced disease, radiotherapy might be the answer. So surgery followed by radiotherapy, or in case of advanced diseases, palliative treatment plus palliative radiotherapy. Hormonal therapy, as 90% breast cancer cases are estrogen receptor positive. Tamoxifen is a drug of choice. The aromatase inhibitors, in case of failure, the tamoxifen. Chemotherapy is also an alternative if hormonal therapy. Biological therapy, which is a epidermal growth factor receptor 2 agonist, can be used after chemotherapy to prevent recurrence. We're talking about the herceptin. As you're aware so far, there's like huge similarities between the management course of female and male breast cancer. So to conclude that, thank you very much for listening. Um, Also, as we have, Pink October can be for men and for males and females. This is the pink ribbon representing there is still 1% chance there's 1% chance of breast cancer to happen in male. It's also worth considering whenever you're suspecting that. Thank you very much.